Okay, so just to start off, we're obviously here to talk about the report from the AAN about the shortage of neurologists. So I'm wondering if you could just speak a little bit to what's driving, in your opinion, this shortage and how it's currently impacting patient care or how you see it impacting care in the future.
Sure. Thank you for having me on this segment. The shortage of neurologists is multifocal in where it comes from, but a big part of it is the fact that our population is aging. So as patients get older, they are more at risk for stroke and Parkinson's disease and Alzheimer's and other diseases of the aged. And so that just by in itself will raise the number of patients who need specialty neurologic care. However, I think we're also, I guess you could say, victims of our own success. We now have amazing treatments for multiple sclerosis and epilepsy and migraine. And all of those are diseases not just of persons who are elderly, but also in their productive years. And so it has seemed to me that there is more need because we have more to do. So there's diseases now that we can treat, and patients are aware of that. And so they and their primary care providers want to refer them. Then the other side of the shortage of neurologists is that even though we do have more neurologists now than we did in the past, we're not keeping up with that demand. So the supply is going up, but it's going up more gradually than the demand. So as far as how the shortage is affecting patient care now or in the future, it's a little hard to get the numbers on that. We do have numbers on wait times. We know they've been going up and in certain areas more than others, so that it takes longer for a patient to be seen as a new patient into a neurology clinic. However, even beyond wait times, which some people may say, well, that's just a matter of convenience or demand. Really, there are studies that show that if you see a Parkinson's provider, a neurologist who specializes in Parkinson's disease, you are less likely to fall than if you see your primary care provider. And in epilepsy, if you see someone who knows what they're doing in epilepsy as a neurologist, you have fewer seizures, which means fewer car crashes and less mortality. Clearly, in stroke. Again, more likely to get TPA or thrombectomy and more likely to walk out of the hospital. So it really does drive patient outcomes in the end, even though this data has been a little hard to get. We've seen it in some smaller papers that having access to a neurologist does improve patient care. It's one of the things that we've asked the AAN to consider, and whether this happens or not, I don't know, but we think it'd be great to have fellowships with funding in research and health services research, just looking at this specifically, so that we can better quantify the value that a neurologist brings to the patient. Because in the end, that's what we think we all do, is bring value to the bedside. But it would be nice to be able to prove that with more rigorous data than what we have available right now.